Cornerstone Physical Therapy. I work at our Woodfin location in North Asheville. So if you're familiar with kind of Beaver Lake area, right around that area. So today, let's all take a breath. We're going to talk about how to breathe. So let's go ahead and get started. And as I go through the presentation, if you have questions, please type them in the comment box or in the comments below. Our marketing director is monitoring those. And at the end, there'll be time for me to answer questions. So, and I can also get back to those later if you're not watching this live. So let's go ahead and get started. Let's see here. Okay, so talking about our clinic a little bit, we've got, it's a locally owned PT clinic since 2008. We've got 3 locations. As I said, I work in the Woodfin location, but we also have a location in Arden in South Asheville and then East Asheville. Some specialties, although I'm a pelvic health specialist, we offer help with a lot of different things. General orthopedics like neck, back pain, you name it. Pelvic health, like I and a couple other ones of us do. Jaw pain, TMJ, and facial pain. CrossFit and weightlifting, lymphedema, and massage therapy. And you can see our website listed there at the bottom that you can find out a little more information. So let's talk about breathing. Breathing is important for a lot of different things. It is part of our core control. So I know a lot of you guys probably hear people say, oh yeah, work on your core. Well, what does that mean? Breathing is actually a part of that. So it's an intra-abdominal pressure system. And there's different things that proper breathing or breathing exercises can help with. One is decreased leakage, and I'm referring to incontinence, urinary or fecal, decreased pain, increased relaxation, and improve elimination, whether it's urinating or having a bowel movement. Okay, so who should do breathing exercises? Well, really everybody, but just to kind of point out a few different categories. If you have weak muscles, thinking about more of the abdomen and pelvic floor, if you're experiencing leakage, if you have just had surgery, especially abdominal surgeries or anywhere in the pelvis, vaginal, rectal, prostate surgery, for you men, during pregnancy, after pregnancy, and even before pregnancy. I see a lot of my ladies either prior to getting pregnant or during that they just kind of want to make sure they're pushing and breathing right, especially if it's like their first pregnancy. So the core, I mentioned this earlier. You can see in the picture there to your right, a picture of some of the main core muscles. So this is a side view of the trunk if someone were kind of to cut you down the middle. Some of the main ones we're going to point out. At the top, you can see the diaphragm shown. So if you can find your rib cage, that muscle sits right underneath like a dome shape. The transversus abdominis you can see there. If you imagine a corset, kind of like women used to wear back in the day with the crazy dresses where they couldn't breathe, it's really broad. It goes from the bottom of your rib cage all the way down to your pubic bone, really low in the abdomen, and it wraps all the way around to your spine. So transversus abdominis, that is the deepest of the abdominal muscles. Then at the bottom, you can see kind of this hammock type shape, pelvic floor. So whenever you hear me say that, those are the muscles we're talking about. Can't see them, they're on the inside. You can see they kind of hammock between the tailbone and the back, all the way forwards to the pubic bone in the front. And then some other ones to point out in the back, you see the multifidi muscles. Those are the deepest muscles along your spine, from the top of your head to your tailbone, but we're just kind of looking at the lower back sacral area. And those are the main ones. So all those abdominal muscles, diaphragm, pelvic floor, and even the surrounding muscles at the hips that aren't shown in that picture, but a lot of us also consider part of the core, your glute muscles, hip rotators. Some of those muscles actually start inside the pelvis. So process that for a second. There's your picture. And let's move on. Okay, so what's a breathing exercise? Let's keep it simple. So it's as simple as taking a full breath in and a really long breath out. Slow down your counting, focus on what you're doing. So there's an example given there for you that I can demonstrate. 4 seconds in through the nose and 8 seconds out, like you're breathing through a straw, and it looks like this. Kind of double the time on the exhale where you actually have a chance to engage some of those deeper core muscles, especially on the exhale. That's when they want to kick in more so. Okay, and you can see in the picture, she's showing a great example. What I'll sometimes give cues for my patients. Hey, put one hand on your chest, one hand on your lower abdomen so you can monitor what's moving. A lot of the times when we're doing this deeper, more what we call diaphragmatic breathing, we're focusing on more abdominal movement, which we're going to get into. So they can monitor which hand is moving more, and often we try to have them limit the chest and more at the abdomen. Okay, so here's a nice little depiction here. So as I demonstrated earlier, let's kind of go through the numbers if you can see in the picture there. Number one, the belly's going to expand. You're going to breathe in. We usually have them breathe in through the nose. And then second picture, you're going to exhale and belly in at the same time. And you can kind of do either on the second part of that picture. It says belly in first and then exhale, which is totally fine. Some people find it easier kind of starting with one versus the other. It's a coordination thing, and this can be tricky if you've never done this type of breathing before. So again, let me slow down a little bit. Inhale would be belly out, and you're breathing in through the nose. Exhale, belly in, breathe out through the mouth. Kind of like you're going to whistle. There's a reason for doing that pursed lip breathing, and that's because, as I mentioned at the beginning, it's a pressure system. So if you purse your lips, that air is going to have a little bit more difficulty getting out, so it gives the chance of those deeper core muscles to help, to engage more. Hey, let's help get that air out through now the smaller exit way. It's a pressurized system. So let's make sure I mention everything here. The diaphragm is lengthening down, as that's why you see the belly expand, because you can see in that first part of the cartoon there, the diaphragm's actually dropping and expanding as the rib cage and the lungs have to expand as well. So it's that big belly on the inhale. And at the same time, for those of you who are more in tune with your pelvic floor, and if not, you might have to get with a pelvic PT to really know what I'm talking about. But you can maybe sense kind of, if you're female, kind of like labia, anus area, or male underneath the scrotum, anus, kind of like a widening or a softening on your inhale. If you do a good job with this, you can sense that happening. We also refer to that as a reverse Kegel. So that's what that's talking about. Okay, exhale. We kind of already went through this, but let's break this down a little bit more. So again, we're doing pursed lips, and it's pretending kind of like you're breathing out through a straw, or almost like you're going to whistle. And on the exhale, you can see in that cartoon, the diaphragm is lifting up. That's how that diaphragm contracts to help get that air up and out of the lungs. The abdomen draws in, hollow belly. And when you feel this or do this intentionally, you're going to feel a tension, especially in the lower abdomen. That's that deepest abdominal muscle, the transversus abdominis, working, that corset muscle. You're going to feel like, oh, I feel like a rubber band tightening, so to say. And then as you exhale, naturally what's happening is a Kegel, actually, for those of you who know what that is. It's kind of that internal lift, vaginal or rectal, that you feel a tightening and a lifting up. It happens on its own to a degree, and we also work with people to do that on purpose to coordinate between those different core muscles. And I'm going to get into that a little bit later. Okay, so again, why? What's the purpose of doing this type of big belly breathing, or we also call diaphragmatic breathing? And you can see the list there. It can relax your pelvic floor, especially on the inhale. A lot of times I'm cueing my patients who have pelvic pain, like, hey, sense that kind of expanding, that softening on your inhale. Pay attention to that. If you don't feel it, can you do it on purpose? Can you kind of gently almost push down a little bit and feel that softening, that widening on your inhale? It can reduce pelvic pain, as I just mentioned. It can improve voiding. So when we go to urinate or have a bowel movement, there's coordination going on between our breath, our abdominal muscles, and our pelvic floor. If that coordination is off, you're going to have more difficulty fully emptying your bladder or having a bowel movement. You're going to catch yourself straining, and you might not think you have a problem because you're like, no, I feel like I fully empty. But if you are peeing a lot, maybe you don't, and maybe you might need to see a pelvic PT. Okay, and getting into more nitty-gritty details on the exhale, again, we talked about kind of sensing that drawing in. You can think about zipping up as a cue. We'll use sometimes the Kegel, kind of lifting and supporting the pelvic floor. What's the more benefits we can gain from the exhale focus of this breath is what we're talking about. So strengthening, lifting the pelvic floor, reducing leakage, urinary or fecal, reducing weakness. The pelvic floor are part of your core muscles, again, as we saw in that first picture, and delaying, bladder or bowel, like having to go to the bathroom all the time. Sometimes that comes from weakness and some incoordination or issues in general with the pelvic floor. Yeah, and just core control. You're doing Kegels on the exhale often. Intentionally is what, again, we cue with our patients. So we'll move on. So some common conditions or scenarios where this breath training we use for people. Again, weakness, if they need to get their pelvic floor stronger because you're having leakage or you have what you may have heard of the word prolapse, you feel kind of like a falling out feeling. It's more common in females. Like, what is going on? Something is falling out of my pelvic area, vaginal, this is not normal, or I have some lower abdominal heaviness. If that's you, you may need to talk to your doctor or just come on in and see us and we can evaluate that. Doing the belly draw in and the Kegel, again, you're focusing on that with this training. We already talked about incontinence. We already talked about before, during, or after having a baby. This is really helpful. Just preventing conditions, treating conditions, helping that woman, especially if it's her first child, learn how to push properly, using her breath to help her. Before and after surgery, especially abdominal, back, or pelvic. If your muscles are too tight, this can come into play and be helpful. Relaxing the pelvic floor, and just referring to the different things we were practicing earlier, that big belly breath, that's what we're talking about. Again, pain, I think we covered all of those, so take a look at that now and later. Okay, so if you're coming into a pelvic specialist like myself for physical therapy, you might be like, what should I expect? I have no idea what this entails. It's not what you might think. Just to give you feedback, these are one-on-one sessions. We have a private room. So number one, that should make you feel a little bit more comfortable. Anything you talk about, people aren't overhearing our conversations. We're going to assess various things, including your pelvic floor, your abdomen, diaphragm, back muscles, hip muscles. It's an individual assessment. We're going to cater any treatment, which will likely include, it will definitely include breathing training, but we're going to cater different exercises or treatments based off what you have going on, what you're experiencing. Some things that might and does involve muscle training, strength, relaxation, as we touched on, and coordination. And you can see that little picture there that's showing some biofeedback. That is something we also use with practicing Kegels or relaxing the pelvic floor. We have sensors we use, either external or internal. We practice coordinating with breath and with pelvic floor, what those muscles are supposed to do. And it's nice because the patient has a display that they can look at and see how that line or bar graph is changing, or different images. And behavioral training too. So this is usually the trickiest part. Issues of incontinence, pain, whatnot, is we're going to get into detail about, are you drinking enough water, fiber, how do you go to the bathroom, are you pushing, are you holding your breath, and various other things that we would get into. Okay, in North Carolina, it's awesome. We have direct access. So you don't actually need a referral first. If you're Medicare, it's nice to go ahead and have the referral, but even so, we can still go ahead and evaluate you because the evaluation gets sent off to your doctor. And almost always, the doctor always signs off on it, so you don't have to worry about that. It's covered by insurance. And our new patient coordinators help you with getting that set up. You can call our number, which is 828-684-3611. I think it's listed at the end of this PowerPoint, and of course on our website. So they're going to talk to you about your insurance and get the different details for you when you set that up. So, and there's 3 options to change your core. So you can, of course, come and see us again. I'm in Woodfin. Laura is at our Arden facility. I don't think yet we have right now at East, but we will have a pelvic PT there. Things have been a little crazy with COVID stuff. You can also do telehealth if you're like, I'm kind of uncomfortable. I'm older. I have some conditions that I don't feel comfortable coming in person. That's fine. Let's talk through video, live chat, and talk about some things that you can start to work on until you feel comfortable coming to see us in person. And you can do a combination. If you're like, hey, I live far away, but I want to get started on this, or whatever the scenario is, you can come see me or Laura at the clinic and telehealth. Not a problem. Okay, so I'm going to ask Elise if there have been any questions. There have not been. If you do have questions because you weren't watching this live, or you just need to process this information, please post them in the comments below. We will get back to you on those. I'm more than happy to answer any of those questions, and look forward to potentially seeing some of you in the future. All right, thank you, everybody. And we're going to end this.